It's been another turn of 7 days since we last saw you on this our program. That's because Nigeria joined the world stage in promoting welfare and dignity of senior citizens. That was in 2017 when the National Senior Citizen Center was established with the key objectives of promoting the general well-being of senior citizens, provision of capacity building and other social services to enable them age with grace. Since the takeoff, the NSCC has been engaged in promoting policies that protect rights and interests of senior citizens and collaborations with stakeholders and agencies to support the elderly. This is Reshaping Democracy. I'm Ayodeji Makinde. The captain of the Nigeria Senior Citizen Center, Dr. Emem Omokaro, has been the backbone and the spine of efforts to ensure Nigerians above 60 are not left behind. The Director General is on Reshaping Democracy to answer citizens' questions on the journey so far.
My name is Obiora Okafor from Abuja in Anambra State. DG Ma, what initiative have the center implemented to promote social inclusion for senior citizens, and how do these efforts address issues of loneliness and isolation?
It's a very deep and wonderful question. Now, the mandate of the National Senior Citizen Center is to identify the challenges of older persons and to cater for those challenges. And rightly, as that question is, one of the basic challenges of older persons, ageism. Ageism meaning you have society having a stereotype, negative stereotype about aging on older persons, leading to prejudices and discrimination. So older persons for a long time have really been marginalized. And so if you talk about sustainable development issues across all the aspects, older persons were rarely included. So, but with the setting up of the center by legislation, the act mandates that we ensure that older persons are included. And how is that done? There are two ways that we do that. One is by a strategic development plan, 10-year strategic development plan. There are two pathways. One is aging mainstreaming. That is by identifying the ministries, departments, and agencies of government that have mandates on different aspects of human development, whether it's health, social programs, transportation, housing, and to ensure that older persons are included. And so we have worked first and foremost to develop these engagement mechanisms. So we trained, and now we have aging desk officers in about 40 MDAs. And we are training and retraining them, one, to make them understand the peculiarities of older persons as it concerns their mandate. And then also to understand the mandate of NSCC and the programs that we run, that we do in collaboration with the agencies. So I give you a good example. In terms of health, NSCC is very focused in the aspect of healthy aging. And you know that, of course, the mandate of health is with the Federal Ministry of Health, and it's also with the primary healthcare development agencies. But as an agency with mandate on older persons, one of the challenges of older persons is how to ensure that they maintain their intrinsic, their functional capacity, that we don't allow it to decline. And for those managing chronic conditions, we ensure that they have health education, they understand the importance of exercises, and then we also run medical outreaches to support older persons. And then where their functional capacities have declined, we give them assistive devices. So that's a good example. So ensuring inclusion in aspects of health by initiating, by collaborating, and then by facilitating across. And also in terms of income security, you know that there are also ministries, departments, and agencies of government that have mandate in these spaces. For instance, National Directorate of Employment, SMILAN. But NSCC is also in this space to ensure that we make them understand the productive capacities of older persons. That the fact that they are old does not mean that they have stopped their livelihood ventures. There are still many older persons in the communities, especially in arts and crafts. Many older persons still teaching, many older persons still employing their capacities to continue to be significant and to do. So what have we done? We have created so many programs in this area. First, we have identified older persons' livelihood ventures. We first did a needs assessment across this country, which we have published, so we have the data, and we have also now, aggregated them into multipurpose cooperatives. So now we are empowering senior-led multipurpose cooperatives to ensure that they're included in capacity enhancement, they're included in entrepreneurship development, they continue to make their money. And then also talk about inclusion. Our older persons are retired professionals, are retired technocrats. A good example is media veterans and older persons from the Nollywood industry. We have now mobilized them, brought them together. They are now our goodwill ambassadors and enjoying themselves, advocating for themselves for age-friendly environments. And then now they are coming together to create content for drama and things like that to support NSCC to promote inclusion. And so look at our retired nurses. We're trying to bring them back in the field of geriatric social care. So our older persons before now were excluded because there was no focal agency that really advocated for them and created programs that will promote inclusion and participation. So across the length and breadth of our programs, what you will see, which is one of our core values, like a value charter, is inclusion and participation based on the value of human rights.
My name is Rotarian Winnie Aganya from Amobia, Anambra State. DG Ma, how does the center ensure access to geriatric healthcare services for senior citizens, and what partnerships have been established with healthcare providers to support these efforts?
This is one area in Nigeria that was really left unattended. Why? Because traditionally, older persons, were dependent on family, especially on adult children, to care. And so for all that long time, there was no policy. And then, of course, there was really no agency to drive it. So geriatric social care and the care quality assurance system is one of the major focal programs of the National Senior Citizen Center. So what we did was to create a partnership with the National Board for Technical Education, because as the name is, they're in charge of technical education. We persuaded, it was seen that caregiving is a skill. Caregiving to older persons is a skill, and it needed training for competency. So care now was admitted into the Nigerian skills qualification framework, meaning that within the skills qualification framework, we had to identify the training providers, and the training providers needed to be accredited. And so we are working with NSCC now to ensure that the training providers can meet the requirements. And one of the requirements for training will be the quality assurance assessor certification, because now it's a skill. So you have to have internal assessors while they're training to access that. Really, if you say somebody is, has a certificate on level 1, that person can perform as the work environment demands for that level 1. So far, we have developed the National Occupational Standards, first time in Nigeria, for the training and certification of caregivers. So far, we have trained training providers from at least 8 states and Federal University Teaching Hospital with geriatric social care, and they have obtained their quality assurance assessor certification. And we have started now their accreditation. University of Benin Teaching Hospital happened to be the first. University of Uyo now has joined. We just got expression of interest from 1, 2, about 3 universities who had that qualification. So we are doing a lot in this space. There is also the Geriatric Social Care Skills Council. The council now is in place, and what their terms of reference to ensure that the training is standardized, to ensure that they identify the skills gap, they know what the industry needs, what aspects of the training will really help our older persons, especially communications, attitude, ethics, regulations, and so on and so forth. So we have that council in place. And then now NSCC is almost completing the portal, the web portal, which will give the public information. You go, who is certified in the field of geriatric social, you click, you see the names. Who is the training provider that is accredited, you click, you see the names. Where can I get the nearest caregiver that is certified, you click, you see the name. So we are now centralizing everything, and also working with the National Assembly, the House of Representatives, to bring a bill in this aspect to really regulate.
My name is Mohammed Nasir Emem from Katsina State. What measures do you have in place to protect the rights and dignity of senior citizens? And also, how does the center protect those who are vulnerable to abuse and neglect?
Yes, you know that globally, Nigeria is known, I tell you, at the United Nations, well respected to really unequivocally support the human rights of older persons because of Nigeria's participation in the UN Open-Ended Working Group on Aging for the development of Convention on the Rights of Older Persons. When that closed, after gathering all the data, and it moved to the National Human Rights Council, Nigeria is still supporting. And then Nigeria also has ratified the protocol to the AU Charter on Human and People's Rights and Rights of Older Persons. The National Senior Citizen Center Act provided the legislative foundation to really protect the rights of older persons. Right to inclusion, like we talked about earlier, right to participation, right to dignity, and then of course right to access comprehensive care. And Nigeria is ensuring that by ensuring that the National Senior Citizen Center, through the National Plan of Action on Aging, through the strategic roadmap, now unfolds all these programs one by one, intersecting them, and ensuring that it's accelerated to the local government, to the state and local governments. The National Senior Citizen is making sure that the productive capacities of older persons are recognized. When it comes to healthy aging, the National Senior Citizen is creating programs and activities and ensuring that it's rolling out across the states to ensure that our older persons have access to healthy aging, healthy engagements that will keep their functional capacity right. When it comes to geriatric social care, we just talked about it. The National Senior Citizen Center is developing long-term care system that is regulated and ensuring quality so that our older persons are not abused. And when it comes to continuing engagement, that our older persons have a right to still continue to engage even though they are retired, instead of just locking them up. And NSCC is ensuring, that is the federal government is ensuring, that we create programs, retired technocrats, retired professionals, and retired veterans, wherever they are, up to the community level.
My name is Sadiq Garba Abubakar from Katsina State. Is there any collaboration or partnership between your center and relevant government agencies? What assurance is your center going to give the senior citizens in Katsina State?
I have to say first and foremost that the Federal Ministry of Humanitarian Affairs and Poverty Reduction has the purview of our agency. So we belong to that ministry. And of course, you know also that the National National Social Investment Program Agency also is a sister ministry. You can go on and on. So indeed our focus is on social programs. Nigeria, the National Senior Citizen Center has, first and foremost, strong partnership. We belong with the Federal Ministry of Humanitarian Affairs. So We work closely with them in IDP camps. In fact, this year we are rolling out aging desks in many IDP camps. Social support services include medical outreaches and our support of older persons with either treatment and medication, especially support with assistive technology. When we, are in the field, we work with, have partnership with our federal and state university teaching hospital with geriatrics unit. We send them the list of assistive devices that we have, and we work also in partnership with volunteers in the community to get out all these older persons. And so they also submit the list to the teaching hospital. That's a partnership. Our partnership with our stakeholders consultative forum, I forgot that one. Those are really our engine, foot soldiers in every state. So we have the stakeholders consultative forum that is made up of 8 major stakeholders category. So that partnership is very strong. We rolled out healthy aging promotions across 18 states at once, at a go. Why? Because we had these volunteers on ground. So we have that partnership that is very strong. We have the partnership with our primary healthcare in the states, and then we are now building partnership with state governments. So far, about 8 state governments have already domesticated the National Senior Citizen Center Act, I'm happy to say. And we are working with them through these partnerships also to to help them, develop the state policy on aging and then build their capacity.
My name is Chief Fulu Oni. What are the efforts of the center to ensure elders are adequately accorded the necessary attention in the society?
Healthy aging, first and foremost, we must understand is how you commit yourself to maintaining your functional capacities. How you ensure that your motor, your walking ability, ability to hear, that you can reduce to a large extent their dysfunctional, process. And so that means that you must have information. That means that you must be educated as to what to do. That means that that information must include nutrition. And that means also opportunity to get up and exercise, and then to socially connect. So what NSCC has done is that NSCC took time to now develop a framework for healthy aging promotions. We call it Walk for Life Activity, Walk, W-A-L-K, for life activities. And of course, it includes support with assistive devices for those whose functional capacity has already declined, to support them to navigate and access, continue to participate and be included. So we rolled out the Healthy Aging program, Healthy Aging promotions activity across the state, working with volunteers. And then we rolled out the medical outreach, we rolled out the work. Some were marching, some doing exercises, some playing games. So that is what NSCC is doing.
My name is Tunji Omojola. My question is, what counseling services are provided by the center to support the mental health of senior citizens, and how are these services to be accessed?
Yeah, the counseling services is part and parcel of our healthy aging promotions and our medical outreaches, plus the support with assistive devices. I said that we work in a community of practitioners, and most of them are volunteers. And so when we are in the field, you are bound to see a psychiatrist. That's why I told you that we, have partnership with the federal and state university teaching hospital, federal medical centers. And so wherever state we are, the geriatrics unit always partners with us. And so we have these multidisciplinary faculty working with us in the field. And counseling comes as part of that, be it counseling concerning nutrition, counseling concerning mental health, counseling concerning, any motor problem, and so on and so forth. So our counseling program is part and parcel of our healthy aging promotions. So we have that advert that is out. Every community deserves a senior center. One community, one senior center. And we are calling on philanthropies, faith-based organization, whether it's a mosque, a church, you can build senior centers. And in these senior centers, we can now put that frame for counseling.
I am Mustafa Abubakar by name from Yobe State, Damaturu. How does the center engage with the communities to raise awareness about the issue affecting the senior citizens in the conflict affected area?
One of the key aspects, process of our work is direct engagement with senior citizens. When I tell you about our stakeholders consultative forum, and I say we have 8 major categories of stakeholders, one category is association of older persons, major. No matter what that association is. Some call association of elders, some call elders council, a major category in every state. And then another major category is the National Union of Pensioners. In fact, a few of them are co-chairs in this stakeholder consultative forum. And so, in our stakeholder consultative forum, about 70%, 75% are older persons themselves. So truly we are engaging our older people. We would like to do more. And how can we do more? We will do more where we can have state offices.
My name is Daud Abdullahi from Fune Local Government, Yobe State. What future plans and initiative does the center have in place for further support the well-being and empowerment of senior citizens in Nigeria?
I will start by saying, with all sense of responsibility, that in the next 5 years, the way NSCC is going and engaging state governments and getting state governments to understand the program of NSCC and domesticate the National Senior Service Center Act, develop policy on aging, and we're working with them to now break it down to national plan of action, state plan of action that can be budgeted for. Age-friendly charter, where we have developed indicators of age-friendly services. We're going to roll that out in different sectors. So what's an age-friendly bank? What's an age-friendly aviation sector? What's an age-friendly railway terminal? Age-friendly medical service, health services. And then we ensure that we advocate about this across this country so that the service providers know. And then we have also developed Age Watch Index, where we watch and then we score. At the end of the year, it will now rank them. So who is the most age-friendly bank? So I want to really thank, the president for, the inclusive agenda that he is running. The Renewed Hope agenda is an inclusive agenda. And my ministry, has the focal pillar of the pillar 6, which is health, education, social investment. If you further drill down, there is inclusion. So NSCC is there to ensure that senior citizens are not left behind, are included.
Yes, we are getting there in our journey to position senior citizens as indelible part of our nation's strive for an all-inclusive governance. Today, we are seeing more efforts towards empowering senior citizens, improving healthcare and the national policy on aging, all courtesy of National Senior Citizen Center. I'm Ayodeji Makinde. This is Reshaping Democracy. Age gracefully. See you same time next week. Bye-bye.